Have you ever strolled to Instagram or YouTube and look at some people's faces and were, wow, that person looks so puffy, so overfilled. What happened to them? I never want to look like that. I'm never going to do fillers. That was the thought that came to your head. Well, today I'm going to talk to you about the pillow face. It's an overfilled face that is preventable, and if it's already happened, it's reversible. I'm going to get into the anatomy of what happens under the skin, and I'm going to show you how fillers can be used as you get older if properly done. If improperly done, you can end up with a pillow face. I'm Dr. Morgana Colombo, board certified dermatologist, founder of Vida Derma, a science-backed skincare line aimed to help women as they age. A pillow face is a swollen, overfilled, distorted look that happens when facial volume is added in a way that does not respect anatomy and in excessive quantities. It can show up as overly inflated apples of the cheeks, an overly square look to the face from too much filler on the jawline, too much filler around the mouth, creating a distorted, puffy look, too much filler everywhere, leading to a ultra puffy, swollen face. It can happen, of course, from fillers, but not only from fillers, improper fat grafting, improper thread lifting, or excessive tightening of the skin from surgical procedures can all contribute to this distorted, swollen pillow face. Let's talk about anatomy because that's where things go wrong when it comes to creation of a pillow face. So after age 35 to 40, you start losing volume on your face. You lose volume from your deep fat pads. That actually goes first, and those are the fat pads that keep your face actually lifted. Your superficial fat pads, you lose volume, but not only that, they actually descend and spread out with gravity. And that's important because when injectors inject filler superficially into those superficial fat pads and too much filler, that filler spreads and descends with the fat pads, which leads to a very unnatural look. Number two, as we age, our bone starts regressing. You lose bone, especially, in the zygomatic area, like your cheeks. You lose periorbital bone, bone around the eyes, bone on your chin, jawline. And that's important because when filler is injected without respecting the fact that that bone loss is happening and trying to sort of recreate that improperly, the face ends up looking distorted and overfilled. Number three, as you get older, your lymphatics don't drain as well. The lymphatic drainage becomes, less efficient. So if you inject too much filler, you can't properly drain fluid, and that leads to accumulation of puffiness and a swollen look. And then the other thing to take into account is what happens to your skin itself. As you get older, as a result of, collagen loss, estrogen loss, and sun damage, the skin gets thinner and it just doesn't hold filler as well. So when you try to lift with filler alone, you end up looking distorted and overfilled. So the most common causes of a pillow face are, number one, by far, people put way too much filler in their cheeks, especially the mid cheeks. It almost create that look where they can barely open their eyes. The eyes look very small with very puffy chipmunk-like cheeks. Sometimes even too much filler laterally, widening the face way too much. And then they a lot of times forget to account for the volume loss that happens around the cheeks, lower face, and temples, creating a very uneven look. Two, people try to fix their nasolabial folds by directly injecting way too much filler there. And that creates this bottom heavy, puffy, not good look. You want to really lift your folds with a little bit of filler around it and maybe just a little bit on the nasolabial folds, properly injected. And then 3, there is filler migration that it happens when filler is improperly injected, especially around the eyes, nasolabial fold, the lips, and that creates this distorted, puffy face, pillow face. 4, which I think is the most important one, is as people get older and they're losing volume and their face gets saggy and the skin doesn't hold filler as well, they try to maintain that same filler look they had when they're younger, and they try to completely lift their face and get rid of all their wrinkles with filler, and that doesn't work. They'll put like 5 to 10 syringes of filler in their face to get that snatched look, but all they get is this overly inflated, completely unnatural look. So you cannot try to completely fix your face with fillers as you get older. It just doesn't look normal or natural. So how can you prevent this pillow face? How can you still be injected with filler as you get older and not end up looking completely overfilled and unnatural? So number 1, you want your filler to be injected on the bone as much as possible in small aliquots. That's going to give you more structural support without that puff that happens when filler is injected very superficially. 2, choosing the right product is critical. So as you get older and you're losing your natural fat, you don't want to replace your whole face with just hyaluronic acid filler. That's when those biostimulators such as Sculptra and Radiesse really play an important role. They tend to make your body produce collagen, so you end up with your own natural collagen. So those fillers are great like base, and then you kind of do maybe less hyaluronic acid than you used to when you were younger in very strategic areas. The type of hyaluronic acid filler that you inject is very important also. So you want to do something that is more structured on the cheeks, a finer, lighter one, around the mouth, on the lips, under the eyes. So, the right type of filler is really critical. 3 is, like I mentioned before, you cannot completely lift your face and get rid of all your wrinkles with filler as you get older. You have to combine filler with other strategies. That's when your skin tighteners become really important and very helpful in maintaining a natural look. So you want to consider doing things like radiofrequency with microneedling, Ultherapy for deep tightening, resurfacing lasers, such as Fraxel, fractional CO2, ultra clear, to improve your skin and tighten it a little bit so the filler can hold better. And then skin quality is critical as you get older in order to look natural and still have some filler in you. So not only do you want to do those treatments that I talked about to tighten your skin, you also want to get on good skincare, sunscreen every day. You want to get on products that promote collagen, such as retinol, vitamin C, peptides, estrogen promoting agents such as the natural genistein or even estriol cream. So you want your skin to be good. Of course, good skin barrier. So all those factors playing a role in allowing you to get filler as you get older without looking like you have a pillow face and look super unnatural. You already have a pillow face and you're not happy with that. What do you do? So you have a few strategies. One, you can go to a physician and have them apply hyaluronidase and dissolve a lot of that filler, and start from scratch with doing your fillers with the proper techniques that I talked about, deep injection, smaller amounts, combining with skin treatments and good skincare. if you don't want to dissolve all your filler, you can just take a break from doing filler and let some of that naturally dissolve. You can speed up the process of that with things that heat up your skin deeply, like RF microneedling can burn through some of that filler. The Fraxel laser, fractional CO2, ultra clear, they can all make the filler go away a little faster. But importantly is, do not go back to the old habits. Once that filler wears off, don't go and overfill your face all over again. So you want to change the strategy and understand that as you get older, you cannot just put filler in and fix everything. It's combination treatment that really matters as you get older. A little bit of filler, a little bit of like the biostimulators, skin treatments such as devices, lasers, and good skincare to keep your skin as healthy as possible. So a pillow face happens as you try to basically fill aging, get rid of all the wrinkles, completely lift your face and get rid of the saggy skin, all with filler as you age. That is the wrong approach. So the key to aging gracefully and naturally and looking youthful as you're going through that process is to understand that your face has changed as you've gotten older. You've lost fat, bone tissue, your skin is now saggier. So you cannot replace everything with just a bunch of like hyaluronic filler. That's just not going to look natural. So as you get older, that multimodality approach is really important. So can you still do filler? Of course. And it's still very beneficial, but it has to be strategically done. You want deep injections, small amounts. You want to combine your regular hyaluronic filler with biostimulators, which give you this natural collagen that is going to give you a more natural look. You do not want too much superficial filler because that causes puffiness. You don't want too much filler, period. And you want to combine your fillers and biostimulators with treatments aimed at tightening your skin, such as lasers and tightening devices, and proper skincare. If you do all those things, you can still look natural, feel good about yourself as you go through the aging process and still use some fillers. So the key thing that I'm going to repeat again is you cannot get that perfect look that maybe you're able to get when you're younger with all fillers as you get older. It will make you look unnatural and not good. I hope this talk was helpful. If you want more talks like this, subscribe to my channel and, watch my next video.